Hello, everybody. Welcome to Safer Smoking Supply Distribution in Spokane. We're going to start off with a quick word from our partners at the Department of Health. So go ahead, Chelsea.
Thanks, Justin. Hi, everyone. My name is Chelsea Porter. I use she, her pronouns. I am a member of the Drug User Health Team at the Washington State Department of Health, and we are one of the sponsors for this year's Overdose Awareness Series. You can find our Drug User Health profile in our sponsor page on the website. It has a lot of information about the Overdose Education Naloxone Distribution Program, about syringe service programs. There's some handouts around the importance of syringe service programs and information about high-dose naloxone. So check it out. And super excited to hear this next presentation from some of our partners at the Health Equity Circle. Thank you all so much for having me.
Great, and thank you, Chelsea. And so welcome to the last session of today. My name is Justin Mauger. I'm the Central and Eastern Washington Community Health Educator for the Washington Poison Center. Thank you for attending the very last session of the first day of our 6th annual Overdose Awareness Series, Safer Smoking Supply Distribution in Spokane, Washington. Just a quick housekeeping reminder, this series runs with new speakers and topics every Tuesday throughout the month of August. We'll still have tickets available, so please don't hesitate to invite people, your colleagues, friends, family members, neighbors, whoever you think might gain something from being present for this content. Additionally, as participants who are tuning in, you all are muted and I cannot unmute you. So please direct questions and comments to our chat box or the Q&A box, and we'll get to them probably towards the end of the presentation as time allows. Finally, if you want a certificate of attendance, you'll need to take a survey that will be emailed to you from HUVA at the end of the series. Big thank you to our sponsors. We work for Health Washington, Washington State Department of Health, Drug User Program, and Teen Health Hub, as well as the Washington State Healthcare Authority, and specifically the Friends for Life campaign. Now it's my honor to introduce Caitlin Costanza and Morgan Smith, who are both soon-to-be doctors. They attend WSU's Elson S. Flagg College of Medicine, lead and serve on the Harm Reduction Action Team, a group within the Health Equity Circle. These two creatively make a significant difference in our Spokane community. They are known to get things done, and we are so happy to be joined by them today. So thank you, and Caitlin and Morgan, please take it away.
Great. Thanks so much, Justin. My name is Morgan Smith. I'm soon to be second-year medical student.
And I'm Caitlin Costanza. Thanks for being here with us today.
Yeah, we're going to be presenting a practical approach to safer smoking supply distribution in new spaces. And so let's get started.
Perfect. I'll start off by just running us through a basic agenda of what we're hoping to cover today. Essentially, we're going to start off by explaining the current landscape of harm reduction in our community. The specifics of our operation are really dependent on what the harm reduction situation is like in Spokane right now. So we'll go through that. We're going to talk about the evidence-based practice of safer smoking supplies distribution as a form of harm reduction, and how safe smoking supplies allow us to distribute Narcan into our community. And lastly, we're going to go through the origin story of our specific distribution program and how things that we've done could potentially be incorporated by other groups who are hoping to start up a safer smoking supply distribution in their communities in Washington.
Alrighty, so before we start, just a little bit about Health Equity Circle, the organization we're affiliated with. Health Equity Circle is a student-run nonprofit organization that is dedicated to educating and developing future health equity leaders. We have the privilege of being both a nonprofit and affiliated with 2 universities in Spokane, UW and WSU, and I guess Gonzaga too. But there's multiple chapters of Health Equity Circle around the Northwest. Off the top of my head, there's one in Montana and Wyoming. And in the Spokane chapter, we have a few action teams that are led by student leaders. So Caitlin and I lead the harm reduction action team with our colleague Olivia. And there's also a child health action team, food justice, and immigrant and refugee health action teams.
So I'm going to start off by just explaining sort of what our community needs and how we've gone about trying to address that. So starting with the figure on the right, you can see that from 2018 to 2023, there's been a substantial increase in opioid-related overdose deaths in Spokane County. This is multifactorial and it's really specific to our county. I'm not sure about the, nationwide trends, but like this is the problem that we're trying to address and other entities in Spokane have been trying to address. There is an added layer in our community of like higher levels of unsheltered individuals, which is captured by the point in time count. This is a volunteer run operation where people go out into the community and are kind of taking note of how many individuals are living outside or are living with unstable housing. And out of the 1,800 people that were surveyed in the 2025 point in time count, 52% of those endorsed suffering from a substance use disorder in Spokane County. So there are a couple of entities that are trying to address this problem, but are going about it in kind of different ways. So the Spokane City Council passed an ordinance essentially prohibiting glass sales or smoking supply or smoking paraphernalia sales in Spokane in the downtown corridor without providing free Narcan to people who are purchasing that glass. And so because that was cost prohibitive for the businesses in the downtown Spokane area, it effectively prohibited glass from being distributed to the community through the sales mechanism. And so that takes away a safe way for people to consume the substances that they're smoking without taking away the supply. So we are trying to take a different approach to that with more evidence-based practice. So we are still in compliance with the ordinance by handing out our safer smoking supplies because we hand out Narcan as well at the same time. So just a combination of factors trying to address this community need and using the experience that we have. Morgan and I have both worked in harm reduction spaces in Seattle before starting medical school. And so we were kind of able to translate our prior experiences and the vision of what this could possibly look like to try and address this problem within Spokane. I see a question in the chat. If we could answer our questions at the end, that would be great. We'll make sure to address those though. So for benefits of safer smoking supplies, essentially, we know that a lot of people in this room are dedicated to overdose prevention, and I would assume that a lot of us are aware of how safer smoking supply distribution can be beneficial in our communities, but I know that even within the harm reduction space, there are certain people who have differing opinions on the validity of safer smoking supply distribution, and it can come across as controversial in certain spaces. So we wanted to make sure and really address the data. We are medical students and we really want to be doing things that are data driven and evidence based. And so it's important for us to touch on this. But essentially, anecdotally and from studies that we have cited here, many people who use drugs have transitioned from injecting their drugs to smoking their drugs. So this is just something that's happening in the community. And so by providing safer smoking supplies, we're not necessarily encouraging people to smoke their drugs rather than inject. We do also have syringes, clean syringes at our distribution events, but smoking is something that's happening more and more. And so we are trying to address the harm that is associated with smoking specifically. But essentially with injecting drugs, there is a high risk of soft tissue infections, abscesses, and diseases associated with injecting drugs such as bloodborne diseases. And so by smoking, people reduce the risk of those specifically. There are also diseases and illnesses such as tuberculosis that are associated with sharing pipes with others. That is very well documented. As you can see, we have those 5 sources. We have the sources all on a slide at the end, and these sources are going to be available on the website afterwards. But in addition to reducing communicable diseases by sharing pipes, there also is a reduced overdose risk. not only by having your own pipe. So if you have your own pipe and you share, or and you're not sharing with someone else, you're eliminating the possibility of cross-contamination. For example, we know, anecdotally and from research that when somebody shares a pipe, and they're smoking a stimulant and somebody else has an opioid, there is a cross-contamination risk where somebody who has no tolerance to fentanyl, for example, could overdose just with the residue if the pipe wasn't cleaned correctly. So that's something that we are eliminating by making sure that everyone has their own, safe use supplies. And then additionally, there is some data to suggest that there's a reduced overdose risk with smoking as compared to injecting drugs, just simply by route of administration. So when you're smoking something or inhaling something, there is like through your lungs, there's a mechanism of kind of moderating how much is actually getting into your system. And it's easier to control how much you're consuming versus when you're injecting straight into your bloodstream. It's not as easy to sort of moderate. And then, so beyond the function of actually smoking, the function of us handing out our supplies and like why we want to have these safer smoking supply kits at our distribution as a form of harm reduction, it allows us to increase engagement with people who use drugs who are not served by the syringe exchange program that are available in communities. So we have a syringe exchange program at the Spokane Regional Health District. And they do not distribute glass pipes there, but they do have syringes, obviously, and a lot of other harm reduction supplies that we have, hygiene care and wound care and stuff like that. But for people who are smoking their drugs, they are just less inclined to show up to the syringe exchange. And Morgan is going to talk later about the data that we have showing that we have confirmed that we're seeing people at our distribution events who are not being served otherwise by the Spokane Regional Health District syringe exchange. And then with that increased engagement, we have been able to capitalize on that to distribute a lot of naloxone into the community and essentially saturate the community with naloxone. Folks who show up to our events are at risk of overdose or are spending time with people who are at risk of overdose. And it's really important to us as part of our mission to distribute as much naloxone into the community as we can.
So here we go. Great. Thank you, Caitlin. So now I'm going to touch on our kind of like student run operation a little bit. So we do a bi-weekly distribution event in Spokane that takes place in the parking lot of Bloom Psychiatry that you can see right here. This picture is actually from our first distribution event right here on the right side of your screen. And it's funny to look back because this is like the first time we ever did it, and it was just kind of a team of students, and now we have transformed into like a big collaborative event where we have people from the health department and from Chaz and stuff helping out. And yeah, we're really excited with what has been happening and how we're growing and serving people. And moving locations has definitely helped too, and we'll touch a little bit more on that. And then we obviously have an outreach kitty that we needed to include in the slides. But other things that we distribute other than like your harm reduction supplies like pipes, foil, syringes, etc. We distribute some hygiene supplies, wound care supplies, other survival supplies, like in the winter when it was snowing over here, we had hand warmers and hats and gloves that you can see right here. In the summer, we've got sunscreen, like lots of water, and like electrolytes. We also give out naloxone and condoms and food and water. All right. So kind of getting into how we did it. Like we kind of touched on, students that had previous harm reduction experience or were comfortable with the work spearheaded the establishment of distribution. We have the privilege of being a 501c3 nonprofit organization, and we also have like organization-wide resources and grants. However, we will say that almost everything we distribute comes from outside sources rather than grant money, just because we've been able to like be resourceful and had a lot of people that were supporting us. But as a nonprofit and being affiliated with two or three universities, like we have a lot of like breadth and privilege in the way that we are able to do our work. For example, like our medical director is very well connected in the community and also like works at Chaz and like helps us with stuff there. We have registered student organization funds from 2 different universities. And before we were at Bloom Psychiatry, we moved on May 31st. We had our distribution located on campus on like a far corner. So we were, on private property and couldn't be kicked out because we were a student organization hosting a student event. Um, and I've also included the cost of our operation in the corner, just kind of the average cost. So far, we spent about $1,100 of our grant, and since we began, and we average about $185 per month of spending. And the things that we consistently buy only are baby wipes, water, and lighters. We get a lot of support from other organizations for the other things we distribute.
So yeah, as Morgan was saying, like we run our program at a pretty low cost, but we are getting a lot of our materials from community partners and just donations from students. We also are running our program essentially completely on volunteer labor. So we make our kits and transport all our materials and actually run our outreach like completely on medical student, pharmacy student, nursing student, volunteer labor. So we don't have anyone really on the payroll. That obviously contributes to why our cost is low, of course. But as far as like what we've been able to cultivate here, it's a mutually beneficial community partnership between us and a bunch of other services that are in the community. And we've been able to, like with these Saturday events, be able to draw in different features of different services in the community and have everybody kind of in the same place serving people at the same time. So it's been really, really awesome to see how it's grown over time. But as of right now, as Morgan was saying, we have the Community Health Association of Spokane, or CHAZ, with their street medicine program and homeless outreach. And those teams are available every Saturday distribution. So folks who are coming to see us for safe smoking supplies can reliably see a doctor or street med team at our distribution events. So they have now recognized that if they show up to distribution, Chaz will be there. Same thing with Spokane Regional Health District Homeless Outreach. We have Tammy Myers, who does IDs, is there every Saturday, and they have some supplies as well that they can supplement. Like if we run out of something, they usually can help us out. And just like being present in the community and like having that consistency every other Saturday has been really important. And then, like Morgan said, we moved from the WSU Spokane campus to Bloom Psychiatry starting on the May 31st distribution. And that was with partnership with Kayla Cross, who is a nurse practitioner, that's her private practice, and she is able to start participants on treatment, medication assisted treatment or medication for opioid use disorder, same day, like no barriers, same day, like people can show up to distribution and walk out started on treatment, which has been really, really awesome to be able to have that as a feature of our distributions. And Morgan will get more into the data there. And then we also have education, like Justin does a naloxone training for students on the WSU campus. So shout out Justin for that. But it gets people engaged and aware of this issue and like ways that they could volunteer in the community. And so we do have a lot of interest that comes from people like becoming aware of carrying naloxone and things like that come from our fall outreach event. And then as well as we get our naloxone from DOH. So that's been great as well. And then as far as like materials that we hand out, we have a partnership with Project Beauty Share and Smokeworks, which we are both privileged to have those relationships because of being a 501c3 nonprofit. So that's kind of a unique thing there. But Project Beauty Share gives us like makeup and hygiene supplies, tampons. They have like shampoo and body wash and shaving cream and stuff. And then like actually just like, little makeup or clips and stuff, things that really help people just like feel pretty and feel normal. And like that's something that's been really awesome to hand out to people who might be living outside and just like don't have access to those like some would say non-essential items. And then Women's Hearth Day Center, they donate, they're not allowed to hand out tampons at their facility because their pipes can't handle it. So
And
they
plumbing
give us
stuff.
all,
Oh my God.
yeah, their plumbing. Yeah, thank you, Morgan. They're plumbing. So they give us all their tampons and we get clothes from them and deodorant and a bunch of stuff with that. And then we also have just like generous people in the community, like individuals who like really are passionate about this type of thing. And we have a woman named Alden who donates our dog food every other week. And like we just meet up with her and she has dog food in little bags that she hands out or gives us to hand out. And then Compassionate Addiction Treatment or CAT Spokane, they have been connected to us for supplies. So it's essentially a big collaborative effort. And part of what me, Morgan, and our colleague Olivia do to facilitate that is drawing various groups in so that we can all have everything together at once on those Saturday distributions. So it's been really awesome to expand in that way.
Great. Did you touch on the student aspect?
Oh, just yeah, student labor. I guess we have like yeah, different groups like our food justice team through Health Equity Circle, they did a food drive for us. Like towards the end of term when people were moving away, people were like clearing out, students were like clearing out their pantries for us to distribute food. And then we also did a clothing drive. So we've had a lot of donations from students as well. Thank you, Morgan.
Yeah, of course.
And then these are some of the materials that we hand out in our kits. So on the two images on the left, the Be Well and the Be Safe events, those are like two sides of a card that we have in our kits. But we have a bunch of resources for MOUD or medication for opioid use disorder. Bloom Psychiatry is listed on there, but if people are interested and they note that they're interested in treatment for that, we will just connect them directly with Kayla. So in the bottom right, you can see, ask us about getting started on buprenorphine today. So if somebody is interested in that and they mention it or they comment on the sign, we will just like leave from the tent, walk over and do the warm handoff with Kayla. Kayla will take them into her office and they can get started on treatment right then. So that's been really awesome. And then we have a menu here in the middle bottom with just the materials that we have. And then the top right is Safe Spot, which is essentially like a never use alone hotline. So the Safe Spot cards also go in all of our syringe kits and our safe smoking kits so that if somebody is using and they don't have anyone to around them to, make sure that they're not overdosing and keep them safe, you can call the phone number listed there and create a safety plan. So if you stop responding, the Safe Spot hotline will send someone to you, like medical attention, essentially. So that's also included in our kits.
Great. I'll just hop into logistics here. Like Caitlin touched on, all of our labor is completely done by volunteers. Nobody is on a payroll at all. Um, Especially like making our smoking kits, those take a lot of time. So that's completely done by student volunteers, and we give people community service hours for it because our school has a requirement. And we're able to do that because we're a nonprofit. Um, for us, like student leaders, it takes about 8 to 10 hours to prepare for each distribution event. And those hours contribute to like ordering supplies and doing inventory. We are really on top of like how much of something we have just to make sure we can be consistent for people and show up with the correct amount of supplies. It also helps us like be on top of ordering so we don't run out of something. Like we kind of touched on building kits, that takes a lot of time and labor. Shout out to Caitlin, who's been running this like mostly by herself this summer since I'm out of town.
I have
And
help.
yeah, she has help, but like she does a lot of time like making kits just kind of like on her own time this summer. Also, Data management is something we'll kind of touch on in a few slides. We're going to share some of our data and our tracking sheet of how we have been kind of collecting information and what information we collect and why. And then at the end of each distribution event, we take our tracking sheet and enter it into a spreadsheet where we also do inventory and track our grant funds and all of that. We also, as student leaders, organize student volunteers and events, just a lot of messaging people in our like class group chats or in our like school-wide Slack channels, recruiting people to come help us. Also, there's a lot of time spent loading and hauling supplies. Luckily, we're able to store large items on site at Bloom Psychiatry, so we no longer have to like lug a bunch of tables and canopies everywhere. So that's like less work, but we used to have to do that, and we have to like load up all the Narcan and everything and make sure we have everything the night before or the morning of. And also we have time spent communicating with partners, especially like if we need more supplies, like let's say we're out of toothbrushes, we need to text somebody from Chaz or something where we can get more. Yeah, and we usually host about 2 kit making events per month, usually on off weeks, so we can, get started preparing for the next event. So right here, I'll kind of jump into our data now. This is a graph kind of our encounters, safer smoking kits and naloxone we've distributed since beginning our operation in February. As you can see, we distribute a lot more naloxone than we do safer smoking kits. We are one-to-one basically encounters to smoking kits. We only let people have one smoking kit per distribution, basically. So that's why the encounters in safer smoking kit amounts are close, but we've had close to 1,400 encounters and distributed like 5,400 doses of naloxone since we've started. So it's pretty cool. We're really excited about it. Sorry if this is kind of hard to see too. On this next page, we have a different chart that kind of shows a bunch of different things. So I'm going to kind of go through each one of these little bars on our bar chart. But basically, this first one is showing the number of encounters. We only have it since April just because our data analysis has been shifting throughout our establishment since we're still like so new. We didn't necessarily like have it nailed down in the beginning, so we mostly just have complete data like starting in April. But when we started, I mean, off the top of my head, I think we had like 50 people our first day, and then at our last event, we saw 150 people, which is pretty cool. We also keep track of participants that do not utilize the needle exchange resource in the community to see if we're like meeting a different need. So this orange color here is showing the number of people who responded like, no, I don't go to the needle exchange in Spokane, I only come here. And this number is just per distribution event. We are not currently able to keep track of like repeat people, but we're starting to ask people if they are new for like the distribution date, if that makes sense. But as you can see, it's like we had 137 encounters here, and 73 people said they don't use the Spokane Regional Health District needle exchange. It's like close to 50-50 for each distribution, which is awesome. While like we're excited to see people like also utilizing all resources, it's cool to like reach more people since we're doing glass versus just doing syringe exchange, and the regional health district is also a one-to-one exchange. We also keep track of the number of overdose reversals reported, and that's for DOH tracking with our naloxone. But the last time we did distribution, 130 people said that they reversed an overdose since the last time we saw them, basically, out of 150, which is awesome to hear that the naloxone is being used. And we're also keeping track of people who have initiated treatment at each event. And so we only have data for that starting on May 31st, because that was the first time we were able to get people registered for MOUD like on site. And that day we had 3 people get signed up. And since then we've had at least 2 people get into treatment. And this last time we had distribution, we got 4 people into treatment, which is pretty awesome. I'm really excited about it. And then we also just recently started keeping track of how many participants are new at each event, given feedback we got from the health district about like possibly applying for more grant funding and things like that. They're really interested in knowing in what participants are new that date. So on 7/26 at our last event, we had 115 encounters and 55 new participants, which is pretty cool. All right.
And that was, yeah, to clarify, that was the only day that we've tracked that
Oh,
so far.
yes.
So yeah,
Yes. Recent feedback.
because that's the only one that, yeah, that shows up. Thank you, Morgan. And then lastly, I'm just going to walk everyone through kind of how we do the data collection and kind of what it looks like when people are coming up to us at distribution and kind of the questions we ask and how that looks for data. So each column on this sheet is a different encounter. And even if someone isn't getting any glass, no naloxone and no syringes, but we're still serving them with like hygiene or wound care supplies, we still track that as an encounter. So, when people come up, I'd say, hi, welcome. Have you ever been here before? And then if they say yes, I'm asking them if they would like a bubble or a hammer, if they're interested in a safe smoking kit. If not, I will go through the menu of what we have and, explain that we're here every other Saturday and things like that. So with glass, we, like Morgan said, we're one per person per day. So somebody can either get a hammer or a bubble, which are the two types of glass that we offer. And then we have an opt-out as opposed to an opt-in model for naloxone. We just automatically offer every single person who comes to us naloxone, whether they ask for it or not. So I say, would you like nasal or intramuscular naloxone or both? And if somebody is not interested, they can then decline and say like, oh, I have too much right now. I can't store anymore, or I don't need any, etc. And then I would say majority, almost everyone is taking naloxone. So very few people are really opting out. But and then when I am handing out naloxone, I say the last time you had naloxone and used it, did it work? Do you know how to use it? Was it used to reverse an overdose? Making sure people know how to use it, how to store it, and how to respond to an overdose. If somebody says no, or if they had never picked up naloxone before or have never carried naloxone before, I will spend a couple minutes with them, sort of educating them on how to store the naloxone, how to use the two different types, the intramuscular and the nasal. We have a little model with a nose so that I can show people how to do the nasal and the intramuscular, and then knowing how to store it and how to properly respond to an overdose. That's really important to us. And so I'd say we haven't tracked this on our graph, but we have documentation of it like just on our notes, but we probably educate maybe from 10 to 15 people every distribution on how to respond to an overdose. So that's also been really awesome. And then as far as getting services from Spokane Regional Health District, we just ask them, like, do you ever go to the needle exchange at the health district or their mobile outreach in the parking lot of Denny Murphy on Friday morning? So we want to make sure that we're capturing both people who actually physically go to the needle exchange and people who are utilizing the outreach services from the regional health district, so that we're making sure that we actually are serving a community that is not otherwise being served by SRHD. And then as well, we track syringes. We hand out kits of 10 with like a tourniquet, alcohol swabs, cottons, sterile waters, so that people are having a safe experience start to finish with that. And then we total it up and it goes into our data management.
Yep. Yeah, that's most of our presentation. Just also want to emphasize that although our distribution is only, our distribution is only twice a month, 2 or 3 times a month, like we're not able to fully like support the community, right? We're doing
Right.
what we can as students. Like this is kind of like the time we have and like the energy and whatever, like whatever we can do is like that's our max. So it would be best if people could go to the needle exchange and receive glass on a daily basis. So people always have pipes, because it's possible that like somebody's pipe breaks or they lose it or other things happen between our each distribution. So that makes it difficult for somebody to continue to access glass. So I just wanted to touch on that. We'll go through the questions now, and we put our emails here. If anybody wants to connect or anything like that, please don't hesitate to reach out. we're pretty good at checking email.
Thanks, Morgan. And then, yeah, I guess we can check through the chat, or Justin, if you've been checking the chat, that'd be cool.
Yeah, actually, I kind of monitor all of them. So I would love to do that. So first question. So I think this is related to the ordinance in Spokane. Were places selling glass and giving out Narcan or selling both?
So I can touch on that really quick. When the ordinance was just like put into action, there was no policy about offering naloxone to consumers. So it was just selling of the glass pipes at that time. And the ordinance made it so you could not sell pipes unless you also offer naloxone. And that naloxone had to be, the price of it had to be fronted by the business owner. There was no way for them to get like naloxone through like the Department of Health or anything like that because it was for profit.
So it sounds like the answer is kind of neither, right? Like they weren't.
Right.
Yeah.
Okay, gotcha. Then somebody wrote, did I hear that correctly? Drug users are given supplies, i.e. foil, so they can do their drugs.
Yeah, I see that someone has tried to answer that in the chat and they are correct. So thanks to that person. But yeah, foil that you can buy, and people do resort to using foil to smoke their drugs if they don't have clean glass or glass at all. And the reason why we hand out foil is because the foil that we hand out specifically has no coating so that people are not inhaling that coating. So it is essentially also a form of harm reduction.
Mhm.
Sure. And I think we had some clarification just from one of our experts that the coating on certain nonstick foil is not neurotoxic, but when heated in excess of 600 degrees Fahrenheit, it may cause polymer fume fever in the lungs. So I think that's the harm that they're getting at there. Are there any insurance barriers with Bloom Psychiatry?
That is a good
Um,
question.
Yeah, so Kayla is amazing, and I can't speak specifically to her process, but I know that she is seeing people and treating people and starting people on treatment regardless of their insurance status. I know that starting someone on medication for opioid use disorder is billable to like Medicare, but so if that's an option for the person who's coming in seeking treatment, that might be part of her process. I haven't clarified with her, but she's not turning people away who don't have insurance.
Yeah, my guess is it's likely she'll bill Medicaid,
Yeah.
or sliding scale.
Yeah.
Mhm.
Okay. And then I just wanted to revisit also just the question about the giving people who use drugs supplies so they can do their drugs. I think just from what I understand also like that having access to clean and unused supplies uh like doesn't necessarily encourage drug use. I think that people who are going to use drugs are going to find a way to do it. And so the idea with clean and unused supplies is to reduce all the negative side effects, whether it's the coating on the foil or whether it's, you know, somebody breaking up a light bulb to use that as a piece of glass to smoke and having some exposure to other chemicals that might not be in the harm reduction supplies that this group is giving away or distributing. Then, okay, so how can
I'll just
those
touch
in
on,
the
sorry, I'll just add on to that, yeah, I agree with what you said, Justin. It just kind of was kind of you talking about like the harm reduction philosophy, basically. What we do and what we practice is like we recognize that using drugs is people are going to do it regardless of whether or not like we're offering these services or not. So offering people a safer way to use their drugs can in the future like make them safer and possibly like, save someone's life in the end of the day. So we're really thinking about the person and how to help them in the situation they are in rather than seeing it as enabling. Harm reduction is not that.
Thank you. How can those in the community help in this endeavor if those on the ground level don't want volunteers? multiple parts to this question. I'll just read them all and let you kind of figure out how to answer it all together. How can a freelance individual become a free needle in this case? Also, will the slide deck be available or transcript? Yes, we'll have the slide deck and transcript available. The videos will actually be available as well. Volunteers.
We're accepting
Yeah.
volunteers.
Yeah, we are completely volunteer run, so I'm not sure if there's an organization that isn't accepting volunteers. It's probably likely that they have kind of a more stringent like training process or certification process for their volunteers. I know that that's something that is implemented at other harm reduction projects across the state. I used to volunteer at People's Harm Reduction Alliance in Seattle, and they had a training program, but they're always looking for volunteers. So I think that volunteering is definitely possible, but if that's not something that somebody had the time for, but they had financial means to support, we definitely are running this program like as cheaply as possible, but there's a lot more that we could do if we had the funding for that, and we're looking into certain avenues of being able to get more funding. But then also just if you have a connection, if you have a friend that has a business and they have excess, or if you know someone who has a restaurant and they have excess food that they're going to throw away, like we are a way to like connect that through the community. Or if you have clothes that you're trying to distribute or get away, or you were going to donate them to Goodwill, give them to us.
Yeah,
That's all I'm saying.
it's a very good way for you to directly provide aid to your community.
Yeah.
Excellent. Could you provide a flyer with your distribution dates so we can share it with those in need?
Oh, definitely. We have one we can share with you. If that person could just shoot me an email, that would be great. Or I can send it to you, Justin, or somebody with the Poison Center.
Yeah, if you could
that.
post it.
Sure.
The phone number for or the card that we have is in the slides also. We put the card in the slides, but yeah, any one of those.
I'm thinking of the little business card we made also.
Oh yeah, those as well.
There's another one. Yeah, we'll send it out.
Sure. And I just popped my email in the chat. I'm in contact with Caitlin and Morgan. And so if folks want to, send me something, I'm happy to forward it on to them for a response. That may be easiest. I see we still have some time left. I wanted just a couple comments that people made. What a great way to meet an important community need, and really cool that you're serving people who may not be accessing services elsewhere. Y'all are doing so much, especially as med students. Kudos. That was very nice.
Thank you.
Thank you.
Sure.
We're really grateful we get to do this.
What's that?
I said we're really grateful we get to do this work.
Yeah. Someone local to Spokane asked, could the Women's Hearth come out to one of your Saturday distributions?
Yes, certainly.
Yes. Yay.
Yeah. We're
Yeah.
connected to Women's Hearth, and we kind of pick up supplies from them about once a month, maybe a little less than once a month. But yeah, if people from Women's Hearth wanted to show up, that would be awesome. We can
Cool.
we can connect offline about that.
Sure. And again, I'm happy to be a middle person for receiving emails that I'm forwarding on, or answering questions where I can as well. Omero wrote, I've heard about you all at the Washington Harm Reduction Conference, and I've wanted to get in contact. Now I can. Thank you for this. I had a couple, we were brainstorming some questions on the Poison Center side here. Alex and I were, what are ways you would like to see this work grow?
I can start, I guess,
Yeah,
Morgan.
please.
I mean, Morgan and I talk often about like what we would do with this program if we were doing this full time. And like, obviously it would be excellent to be able to increase the number of events that we hold. Like, for example, hold them every Saturday. It has been a little bit of a challenge to communicate to folks that we're doing it every other Saturday, because we can't really print that on our cards of like which Saturdays we're going to be out. So there has been a little bit of confusion, people showing up. Hasn't happened a lot, but people showing up on an off week. So that'd be cool if we could get on a weekly basis. And then being able to resource our supplies is also a challenge. Like we were mentioning, like this is a big collaborative effort, and we are picking up supplies, like Morgan and I and our colleague Olivia, and sometimes friends that we just ask to help us out are like going to different locations in the community and actually physically picking up supplies. So being able to source things for ourselves that are like reliably going to be shipped to our and be available for our kit making, that would be awesome as well. And then the fact that Morgan and Olivia are entering our second year of medical school, but in May we will be transitioning into like our clerkship, which is essentially like clinical education. um we don't um we don't know necessarily who's going to be taking over this work for us, so just making sure that things are running really well, so that it's an easy transition to the person who is going to be taking over in leadership. That's something that we're looking to do as well.
Definitely. We're definitely trying to make sure this program continues after us. Yeah.
Yeah. So I see, Sarah, I see your comment in the chat. I think a lot of it was just answered, but one part, how can others support your goals in Eastern Washington?
Come into distribution,
Yeah.
contributing any things you have in excess or your time or whatever services you can provide to people. We have people who like come and bring meals. So if there's like a business with excess food or something, like we would take that for sure. Um, Honestly, anything and everything.
I also think like combating, like being equipped to have conversations about harm reduction and combating some of the misinformation that's out there. Morgan and I obviously got started in harm reduction in Seattle, which has a different like political landscape, obviously, and a different sort of colloquial understanding of what harm reduction means and what safe smoking supply distribution means and how it works in the community. And so being equipped with not only like anecdotal experiences or, things from our slides, but like really being able to talk about the evidence and sort of help people to understand on a one-on-one basis and have those conversations that are kind of dispelling the myths and allowing us to continue the work that we're doing, because there are going to be people always who want to do this work and not everybody's going to want to do the work, but sort of being able to break down some of the barriers that we face in terms of like funding or public understanding of what this is doing, et cetera.
Excellent. And one of the comments was centered on some of the challenges in other communities with essentially, I don't want to say vigilante, but people kind of attacking the harm reductionists, maybe harassing or I think verbally, I'm not sure if there's an allusion to physical violence there, but have you encountered any like has anyone tried to target you all in our area, that kind of thing?
We have an unfriendly neighbor, and I feel like that's fine to say. And it's something that you encounter when you work in homeless services or you work in harm reduction, is that not everybody's going to understand, and not everybody is going to support this avenue as the way to address the problem that we hopefully, as humans with empathy, all want to help this population who struggles with substance use disorder. But people go about it in different ways, and people have different philosophies about how that is supposed to work. And so I think as far as like moderating that with our actual distribution, um, we're happy to collaborate with our neighbors. We want to run a program that is safe and comfortable for everyone, including the neighbors. And if there are things that we can do, picking up the trash and stuff is the very basic thing that we do anyways and have always done. But, just being able to have those calm conversations and then know at what point the conversation is no longer productive and we just need to move on because we're not breaking any laws and we're allowed to be doing this. And so just persisting and standing up for the people who really need us to be there for those services.
Definitely. We, like Caitlin said, we do spend time every distribution going around and picking up garbage that may or may not be related to the things we
Right.
distribute. I know a lot of people's concern with harm reduction is that it like creates waste. So we're trying to appease everyone, and we really just want to help people and be involved in our community. So we'll go about things in different ways for sure.
So I have a burning question, and people who know me know that I'm kind of one of the how do people take lemons and make lemonade kind of thing, right? So would this be going on if it were not for that ordinance that Spokane passed? Or was your group, was that in response to the ordinance? Is kind of what I'm asking.
I think like Caitlin and I had talked before that about how there's a need in Spokane. I think the ordinance was definitely something that pushed us to act more urgently. However, yeah, I mean, we were going to be the harm reduction leads only starting in like April or something, and we started kind of leading this in February. So I think we definitely were able to get started on it quicker in that sense.
Excellent.
I don't know.
I agree, Morgan.
Yeah.
Kristen in the chat asked, what is the official name of your program?
So we are, yeah, we are the Health Equity Circle Harm Reduction Action Team. Big mouthful, but Health Equity Circle is the nonprofit that we belong to and we're a chapter of. And then within Spokane chapter of Health Equity Circle, we are the Harm Reduction Action Team. So we don't really have a name, but Health Equity Circle, some people know us as WSU students, which is not like totally accurate because we have UW students that participate as well. But yeah, harm reduction distribution is what we call it.
Mhm.
But part of what really made me want to bring you all to our Overdose series, one was being able to see the work you're doing and the incredible impact that you have on our community. I was able to go and volunteer with you all one day and was just totally blown away by the work that you're doing, you know, and meeting people where they are. I think that's so important. But also it was brought upon somebody in a more rural area of Eastern Washington was interested in safer smoking supply distribution as harm reduction within their already existing harm reduction programming. Any advice like to somebody in that situation? I mean, I know, I think Spokane probably feels kind of like, I don't think we're rural, but we're kind of rural in some ways, I think, in comparison to say like Seattle or somewhere. But any advice to people who are working in those spheres where maybe they're looking for opportunity, they're wanting to do this, but they're not totally sure how to go about it?
I would say like moving here from Seattle, I expected it to feel more rural than it does, and it really doesn't feel very rural at all. There is like we ran down the list of community partners that we work with. All of those people were doing this type of work in Spokane before, and we just kind of have had a, you know, magnet effect of drawing everyone into the same parking lot on the same day at the same time. So I feel like my advice is definitely to try and collaborate, and that's going to look different, you know, based on what is available in your area. But I know that at People's Harm Reduction Alliance in Seattle, they have a restaurant that they partner with that specifically packages up their excess food and meals and donates it to the Harm Reduction Alliance to hand out. So there might be, you know, that type of thing, or community centers that might have supplies, and just like being able to kind of draw in those resources all together to be able to maximize the impact. I feel like that's what has made our project really effective, because we couldn't have done any of this just on our own with the money that we have through like our one grant.
Definitely. And something I would add is something is better than nothing.
Yep.
It can be hard to like get started in some of this work. But you know, as soon as you start doing something, like you're starting to help people like right then. About like, do we want to like do this before we have like a permanent spot? Do we want to do X, Y, and Z? And eventually Caitlin and I were just like, we need to do something about it because there's a need and something is better than nothing. And we've been able to continue to do so since.
Great. Then question in the chat, do you all have a website maybe, or social media, anything like that, where people can you know, watch what you're doing or contribute in some way?
Let me find the link.
Health Equity Circle has a website. We don't have a website just specifically for us for our harm reduction distributions. But we are working on getting a social media, like an Instagram page, so that we can communicate like the dates of our distributions, but that is in progress.
Well, I think that this is one of the more robust chats and Q&A sessions that we've been privileged to have. I appreciate everybody who's contributed and your willingness to engage and answer all these questions, as well as coming to present to us today on this important work. Do you have any closing thoughts you would like to leave us with?
I'll just thank you for listening to us. Yeah, we're just, this has exploded in a way that we didn't even expect. Like Morgan was saying, like we just got started doing something and it's evolved into something really awesome. And so, if we can advise or like answer questions, we're happy to do that. We're happy to chat with anyone, after this or by email, but like we're all here in this call because we care about this type of thing. And so just thank you for being ambassadors of this good work.
Yes, really privileged to do this work, and I'm really grateful for this opportunity to present. If you would have asked me a few months ago if I would be presenting at the Poison Center series, I would have said that wouldn't happen. So this is pretty cool. I don't know.
Yeah, thank you, Justin, also for the invite.
Yeah.
Yeah, my pleasure. And thank you all so much. It really, I am just always, and I appreciate my opportunities to connect with you all and support your work, hear about your work, and what ideas are floating around in the community and how they're being translated into action. It's something I'm always happy to be a part of, but also, just to bear witness to as well. So thank you all for coming. With that, I'm going to turn it over to my colleague Alex Sorotsky with some closing thoughts for the day. So thank you.
Perfect. Thank you, Justin. And thank you, Morgan and Caitlin. That was awesome. I was sitting back here just like cheering on at so many points of your presentation and your discussion. This came up in one of the other comments, but I do have to echo it. Y'all, your slide design was amazing. Like, I really
That's
love
all
the
Morgan.
Thank
That's
you.
all
well
Morgan.
done. So just
It was a
go ahead.
pre-made Canva template, but
Thank you, Canva. So just, especially when we can talk about some pretty heavy subject matter in the Overdose series and in your line of work. And it's so refreshing to me to see um, hope, I think, whether that's through slide design, whether that's through the great work you're doing. So thank you for that. And now Justin and I were kind of chatting about how we want to wrap up the first day of our series today. So I've been kind of thinking in the back of my head throughout the various sessions today, and I think for one, I want to thank all of our speakers, so Morgan and Caitlin and everyone else who spoke today. Two, I want to thank everyone who showed up in this virtual space to connect, to learn, to teach, to share, to grow, to form and build community. And, thinking about all the topics we covered under this big, broad banner of overdose awareness, we reflected on Mary Selecki's legacy in public health. We learned about crowd control chemical agents, lead poisoning, poisonous and hallucinogenic mushrooms, substance use disorder in older adults, gas station highs, and right in this session here, safer smoking supplies in Spokane. And that's such a broad range of topics that all fit within this banner. And I for those who caught some of my opening remarks in before the keynote session today, our first session today, I reflected a bit that I've been privileged to be an educator, a public health educator with the Washington Poison Center since 2019, and our first overdose awareness series was 2020. So I was there in the beginning, and a lot of the intention that we had, especially Megan King, my colleague, my friend, my director, who first conceptualized this series, was we wanted to do something to help foster connection and ultimately build community during one of the most stressful periods in their personal lives, professional lives, in the world of like COVID-19 lockdown and isolation. And thinking about that, jumping to now, we're in this other very difficult period of budget cuts, of program cuts. And I think whether it's through the Overdose series, whether it's through the On the Grounds work, whether it's through so many of these other actions we can take. One of the best things we can do is build community, is learn from each other, teach, foster that connection, work on destigmatizing our language, and find these ways to grow and to share the resources that are still there, share the resources that are growing, that folks like you are building. And I would be remiss as a Washington Poison Center educator if I did not take a moment to wrap up by reminding folks of the Poison Helpline as well. That there is this additional resource just to add to your toolkit, that you can contact if you ever need. So if you haven't caught it at other parts of the series, the Poison Helpline, that phone number is 1-800-222-1222. Don't forget that one. That's a very important part of the number. Please, please, please call us in any poison emergency or simply to ask a question. As a reminder, we take calls for folks of all ages. Both Justin and I do a lot of outreach, a lot of tabling events, and a common response we hear is, oh, my kids are out of the house, thank you. And they start to walk away. Like, well, but we can help you too. We can help you with a medication error. We can help you if you have a question about a new medication before something's ever gone wrong. We are a free service. We're open 24/7. That number will work anywhere in the country, and we are confidential. Our goal is to help you. We're not here to judge. We're not here to laugh at you. We're not here to get you in trouble. We're here to keep you safe from potential poisons. Please, please, please call us if you ever need. With that, I think I'm going to wrap up our first day of the 6th annual Overdose Awareness Series. Again, huge kudos and thanks to Morgan and Caitlin for staying on, especially staying on during my closing remarks here. For folks who are still listening to me go on, please fill out the little feedback session, or the session feedback pop-up that should pop up when we close the session. And please join us next Tuesday, August 12th, for another great lineup of topics. We still have plenty of seats available, so invite your friends, invite your neighbors, invite the kind of bad neighbor you referenced earlier, Morgan and Caitlin. The more the merrier. We want to see as many folks here as possible to keep spreading these resources. Okay, with that, folks, I hope you all have a wonderful rest of your day, rest of your evening, and rest of your week. Stay safe and call the Poison Center if you need. Thanks, everybody.
Thank you.
Thank
Thank
you.
you.